always curious about the physician perspective because oftentimes I hear the opposite,
Right.
as in, we're the physician, we know best,
Mhm.
we want to be in control. And so having other decision makers or having other sort of hands in the
Yep.
pot can sort of dilute things or
Right.
make it harder to actually practice.
Yeah.
But it sounds like having the opposite experience or functioning and operating in different systems giving you a different perspective.
Absolutely. I think definitely that kind of patriarchal approach of the physician knows best is absolutely not the right approach for healthcare. I think hopefully we've proven that in many ways, but I think number one, patients should be responsible for their own care and who gets access to their documents. I think respecting patient autonomy is the most important thing. But let's be honest, most doctors are too busy, or it's not within their scope of knowledge or not within their scope of training. I don't think a doctor necessarily wants to call you every morning and say, hey, did you take your medication this morning? Right.
Yeah.
So in that case, the people who are doing that work need access to your chart so they can know you before they call you.
So does AI know best?
Oh, that's a good one. I think there's a lot of people out there who think who've done brief experiments with it,
Okay.
who get very sort of like generally positive results. And they're like, wow, we could use AI for this. And yes, there's a kernel of truth there,
Okay.
but the devil's in the details, right?